what is your role here? I mean, you're a registered nurse.
I'm a nurse, yes. My role here is to help oversee providers and patient care. So I'm a registered nurse. My background is women's health. So I come from an extensive education of women, hormones, aging.
Okay. Now, your most popular machine. I should also mention,
yes,
by the way, because we're live right now, that this hum, this loud hum, is the machine.
It's the actual machine working,
okay,
exactly.
So you say this is the most popular machine?
By far. We call it a 3-in-1. We're able to customize treatments for our patients. This is the cutting edge laser now. It's a light-based treatment, so the paddle is much larger.
So that's an IPL? That's
IPL,
that stands for what?
Pulse lights.
Intense
yes.
pulse light.
So it's not a laser.
And what's that good for?
This is good for browns. Freckling, sun damage, can also deal with reds and rosacea, vessels, any flushing of the skin caused by sun damage and aging, mostly sun exposure, and we're able to really smooth the skin out and give it a youthful appearance again.
Okay, now you have great skin, by the way. Do you use this machine?
I sure do. I sure do.
Now, so you do it to yourself, or you have somebody else do it?
It varies.
Okay. So the
yeah,
second head,
this
what is that?
paddle right here is for laser hair removal, which has come a long way. This third paddle here deals with vessels, facial vessels, leg veins, which we also inject.
So what about little
capillaries? Very
around
common.
the nose?
Yes, anything on the face we can get rid of. Unfortunately, things tend to come back slowly as we age, but if you get maintenance treatments, maybe once, twice a year, we can zap what's there, get rid of it, minimal downtime, you're out the door and it's gone.
Hi, I'm Randy Alvarez. You are watching a special edition of the Wellness Hour. We are discussing medical spas today. In our research, we found out medical spas are not regulated by the state medical boards or by the Department of Health. The Wellness Hour has found that typically a doctor practices there about 1 day a week or signs off on the medical charts but does not actually supervise any of the treatments. Often, estheticians or medical assistants are running the lasers due to lack of funds, enforcement, and laws protecting the consumer. In fact, you don't even have to be a doctor to own a medical spa or have any medical background whatsoever. According to the International Medical Spa Association, over 2,500 medical spas exist around the country. One of the major issues with these facilities is that they take care of the spa part, but rarely deliver on the medical front. We found that many so-called medical spas have untrained people doing procedures without proper supervision in unsafe settings. With such a significant growth in the number of minimally invasive procedures, the number of botched procedures complaints are also on the rise. This isn't to say that you should stay clear of medical spas, but it's vital to do your homework before you book an appointment. Here are some questions we came up with at the Wellness Hour on what to ask and what to look for in a medical spa. Ask them. Who will be administering the treatment? What is the experience? Training? How many hours of training have they had? Are the lasers owned or rented? Can you see before and after pictures of patients who have had the procedure? Can you speak to other patients who have done the procedure? And of course, what is their policy should a situation arise? We have found that when searching for a medical spa, you should look for a center that has a physician on site to answer any questions you may have. Our findings tell us that pricing is about the same wherever you go. So make it your priority to look for a medical spa that is owned and operated by, in my opinion, a board-certified dermatologist, a board-certified plastic or facial plastic surgeon. These physicians should have extensive training in fractionated lasers, CO2 lasers, intense pulse light treatments, peels, facial fillers, and any other treatment they are offering on site. In our next segment, I will sit down with Dr. Corey Maas for a discussion about facial fillers, hot topic. These fillers are designed to create a youthful appearance by filling in wrinkles and correcting unsightly facial folds. Don't go away. We'll be right back.
With the filler technologies that we have, the injectable fillers that used to be just collagen, now we have Restylane, Perlane, Juvederm, there's Evolence and Radiesse that are out there. And for people that like to take one tool and think it applies to every sort of problem on the face.
People meaning other practitioners?
Sure. I mean, other practitioners will say, I only use Juvederm, for example.
When you hear that, what does that make you think?
I think it's silly. I think we have all these different tools that really have different applications, even within the same patient. For example, we'll have a patient that might need a little bit of filler and have a fine line. We'll use a filler for the deep fold and then a fine line treatment on the surface of that with a filler. We might use a combination of 1 or 2 or 3 fillers and a little bit of Botox. Still very cost effective and still things that people can walk in and walk out of here and go have lunch.